Hello and welcome to Kid Institute's podcast from Amsterdam. I'm Bipasha van der Zijde, and today I'm joined by Mayada El-Zoghbi, Managing Director of Kid Institute. Kid recently partnered with the Gaza Health Initiative to address the immediate and early recovery needs of Gaza's health system, which after 10 months of war is now in ruins. Drawing on our expertise in global health and our convening power, we organized a conference in Amsterdam aiming to amplify the impact of the Gaza Health Initiative by uniting donors, policymakers, knowledge institutions, and humanitarian and development actors. Mayada led the team that organized this critical conference. Today, we'll be talking to her about the outcomes of this event and discussing how everyone, from organizations to individuals, can help ensure secure access to healthcare for the people of Gaza. Welcome, Mayada. Thank you for joining us today.
Thank you so much for having me. It's a pleasure to be with you.
Why do you believe this conference was necessary at this moment in time, particularly for Gaza's healthcare system?
Many of us thought that the retaliation to the October 7 assault would be short-lived. This has been the pattern of the conflict in the Middle East for many decades. Nobody could have imagined that it would be nearly a year that goes by with a full-on assault on Gaza and on the Gaza healthcare sector in particular, despite condemnation by nearly all the international bodies, the UN, ICC, and so on. And so there's this massive need to ensure that there's support going to the right organizations, to the right causes, and there's so little in terms of resources that coordination is essential to make sure that we're being as effective as we can be. So that's why we felt that the longer this goes on, the more precise we have to be in terms of the kind of support that is allocated to the healthcare sector. And so we felt that was the role that we could play, is to help connect the dots, make sure that the right organizations, the right funders, the right decision makers can be brought together to help support the sector.
You touched upon coordination and bringing people together through this conference. We had hoped to convene key organizations and actors who have a presence in Gaza. Was this goal achieved? Who were some of your highlights?
We're very happy with what we were able to achieve in such a short period. I mean, we did have just one day together. We had the World Bank, we had the WHO, we had UNRWA, we had the Ministry of Health, we had a lot of nonprofits who are on the ground doing essential work like Medical Aid Palestine, like ANIRA, like Save the Children, like Palestinian Medical Relief Society, like Ta'awan, which is previously known as the Welfare Foundation, all the major organizations that are active on the ground. It was incredible, actually, to have them all in one room, because even on the ground in Gaza, I don't know if they have the chance to connect in the way that they did when we were together here in Amsterdam. The biggest disappointment that I have to be honest about is that we invited a lot of the donor agencies, both the bilaterals, multilateral, FCDO from the UK or SDC from Switzerland, AFD from France. None of them came. And that was a major disappointment because we know that they care and we know that they are struggling to meet the demands. And it was unfortunate they weren't in the room to hear directly from the organizations that are actually delivering the services.
Sigrid Kaag, the United Nations Senior Humanitarian and Reconstruction Coordinator for Gaza, was scheduled to join us for the conference, but she had to cancel last minute and send us a video instead. Did any of the very specific calls to action that she referred to in her video stand out to you?
So it was wonderful to have her video. I think what stood out, it's really the fact that without a ceasefire, it's really hard to have meaningful impact on the health sector in Palestinian territories. She also said that Palestinians deserve healthcare like any other people, and that humanitarian aid needs to get to them. There is this understanding that we cannot wait. Like she actually said, we cannot wait until there's a ceasefire. So there is a need to keep the support coming in whatever way. And there we need humanitarian actors to be able to have access. So the corridors have to be opened. There has to be safety for the humanitarian workers. There has to be safety for health workers. to deliver the life-saving services that they're offering. That really stood out for me from her comments.
Thank you. We've talked about the pressing challenges Gaza's health system faces in previous podcasts, like the access to basic necessities like clean water and soap. Many of the participants at the conference came straight from the field, from Palestine, straight from working on different aspects of the healthcare system. Were there some updates to these requirements?
There are still needs for the basics. It was so interesting to hear how often the word soap came up in the meeting, that just access to water, access to soap, access to electricity. What I heard that was a little new for me was how much capability already exists in the Palestinian territories that I think is sometimes underappreciated. This is a very long-term conflict, and that UNRWA has had a pretty important role in essentially functioning like a government in the Palestinian territories for many years. And they have built up really deep capacity. So you have a lot of professionals who have been trained and who are capable of delivering services. So organizations like the Palestinian Medical Relief Society, Jazor, UNRWA, and others are already there and can deliver these services. I heard a lot around, let's just support these health workers with income. They're not receiving pay right now. So in order for them to focus their attention on getting up in the morning and going to work so that they don't have to worry about feeding their families, something as basic as helping these workers get paid can actually go quite far.
You mentioned that we should focus on basic services. Could you elaborate what that entails?
I mean, something like 70% of the population in Gaza are children. Think about immunization. There's women giving birth every single day, just helping with maternity care, helping with childbirth. This is why midwives are so essential. You don't necessarily need to have fancy hospitals for this. You just need community health facilities where a mother can take her child if they're sick, where someone can go and give birth.
The focus of the conference was on early recovery and transition phase. What led you to focus on this phase at this time?
What tends to happen in emergency situations is that there's a flood of support for the emergency period, and then people walk away. And we're not necessarily thinking about the longer term or the intermediate term or the transition. And so the idea here was to try to understand how these two things come together and how to start already the planning for the future and allowing us to think about how to sequence. One of the things that came out very clearly, and I heard it most from the Palestinians, is that we need plans, we need roadmaps, we need to know what we should be prioritizing the moment the war ends.
And what role do you see KIT playing in the implementation or the next phase?
KIT played a very important role, which is the brokering role. What we felt was needed was that there are all of these different actors, the international players who knows how to work in crisis environments. Then you've got the local NGOs who are not necessarily plugged into all of that and are often forgotten and missed by the formal aid structures. And then you've got the diaspora, which is our partner with GHI, which really represents the private individuals, private doctors, private organizations throughout the world where the diaspora are active, who have resources and have knowledge that could be used. And it's rare that all of these things come together. So what we were doing is bringing these actors together, creating those relationships and brokering those relationships. Now, we see ourselves as possibly continuing to play an important role in facilitating and brokering. We also see one of the things that was very evident from the workshop or the conference on Friday was that advocacy, and we felt that this is something that we can play an important role in. So advocacy with the international organizations, advocacy with the governments that may be supporting intentionally or unintentionally the war. Obviously, we already partner with many of the nonprofits and many of the organizations on the ground. That is something that KIT does already. We already have a partnership with Jazor, which is one of the leading nonprofits in Palestine. And we do focus on mental health. We have a mental health project with them, and we will continue to do that. We anticipate that that will continue to grow. We typically play the knowledge partner role. We also support WHO and other international players, often in different crisis environments. So we hope to continue to play that kind of role in the future.
Some of the key topics that were discussed within the sessions and the panels, in addition to the understandable lack of access to healthcare, were strengthening the health force and health education. Why are these topics so important?
Healthcare workers have been targeted in Gaza, and there's been a very large number of healthcare workers that have died. At the same time, the young people who are getting education to be healthcare workers in the future, their education has completely stopped. All the universities in Gaza have been affected. None are currently functioning. So there have been some students who have been able to study online. There's something called PalMed, which has partnered with 2 universities in Palestine, and they've been able to have some online education. However, the vast majority of students are not in school. They're not studying. They're unable to. So the idea that the future, you need to have a future workforce. You need to have people that are trained. If we don't do something to support those students to finish their education, there will not be a workforce when the war ends. We have to help strengthen the Palestinian workforce. It is the most efficient way to make sure that there is care locally, rather than having to take people outside of the country, which is significantly more expensive, rather than having to bring in doctors from the outside to give the care that's needed.
How does international collaboration, such as what we saw at the conference, drive tangible change for Gaza's health sector?
So one of the things I heard a lot from a lot of the participants at the event were, oh, I didn't know this organization was doing this, or I didn't know this organization was leading in that space. So what collaboration does is gives clarity on who is doing what. It allows us to complement one another as opposed to duplicating. We kept hearing over and over again, there is no need for everyone to be doing medical missions. That is essentially right now what a lot of the organizations try to do. There are already many doing it, and there are many that are quite effective. We don't need to be duplicating. And so this kind of event that basically sheds light on who is doing what and shows where there are gaps in the needs can maybe help an organization that has all the good positive intent, but doesn't really know how to direct that intent. Now they can see that mental health is a serious concern for the entire population. Maybe there's something more we can do with mental health, or maybe there's something we can do with addressing the medical education sector. Maybe we don't have to create our own initiative. Maybe we can join and support the existing initiatives that are already there.
Come to my last question now. At the conference, you mentioned that the convening of institutions like the World Bank and the World Health Organization under one roof at KIT to discuss the crisis in Gaza gave you hope. Why is that?
So on a day-to-day basis, people like me are reading the news and seeing the TikTok videos, and it's quite depressing. And you start to feel very small, and you feel that there's very little that you as an individual can do. Now, when you are sitting in a room with a couple hundred people who are all high caliber, all with the right intent, all with the right capacity, all working towards the same objective, it really feels empowering. It feels like we are able to do something collectively that none of us would be able to do on our own. So I get a lot of hope. I get a lot of energy from being in the same room with the likes of those organizations. I have to say the Palestinian organizations are even more impressive than anything I could have imagined. I do think it just gives you faith in humanity, that there are people out there doing the right things.
I'd like to know, for the people listening, you talked about taking collective action. Is there any action that anybody listening can take?
So on an individual level, I would say the easiest way to take action is to support financially, if you can, some of the Palestinian organizations, some of the education initiatives that are being launched to support the Palestinian emergency and hopefully recovery soon. The advocacy agenda is a massive agenda. One of the things that came out in the event is that Save the Children, they said, if you're a Westerner, one of the most effective things you can do is show up at the protests and be heard by your government, because the governments need to feel the pressure that their people want this war to end, and they want their governments to be supporting the right side of history. So all of us should be making our voices heard as much as we can. If you have technical expertise, obviously you can support some of the nonprofit work if you can, directly or indirectly in some way.
Thank you, Mayada, for joining us today and for sharing the highlights from the conference.
Thank you so much, Bipasha, for hosting me and for allowing me to represent the event. Thank you.
Thank you very much for tuning in and listening to the KIT Institute podcast. Follow KIT Institute on LinkedIn or KIT on Facebook, or sign up for our monthly newsletter on our website, kit.nl.